It's so good to see your smiling faces after an amazing Metabolic Health Summit 2022. I can't even believe it's behind us. I don't know why, but it's wild. How are you guys?
Doing well. Yeah, it seems like it was so long ago.
It does kind of. It's weird.
Yeah, as I posted on social media, I was like, I'm almost in like disbelief that it happened because I feel like the two words that come to mind is like delayed gratification, at the craziest level, right? Because you work for like, gosh, 2.5. I mean, since 2019, we've all been, working at getting this thing back up and running again, and finally it happened, and you're like, whoa, what just did it just happen? Okay, it just happened, and it was amazing. It was honestly, coming off of what we came off, I don't even have to really mention it. It was hard to know, which way would go, how people would feel coming back together with like large groups. But honestly, I don't think it could have gone any better. I mean, the location of, so today we're going to kind of just break it down of like what happened at Metabolic Health Summit 2022, how we're all feeling in the process. There's so many people that make this happen. Really, it's like such a massive collective effort that kind of comes together and in this crazy, beautiful way. I'm excited to kind of dive into things. I would say right off the bat, in talking about sort of it being a collective effort, I have to give a huge shout out to our staff and our volunteers, because we have some of the most amazing people on our team, people who've had, extensive experience in events, Kimberly Newman, have to give her a personal shout out, all the way to PhDs and people from your lab who, donate their time, or from all over the world who are involved in the research and just are so passionate about it that they want to give back and support in what we're doing, which, every year I'm just blown away by the people that support MHS and help us make it happen. So thank you to our staff. The location was out of this world. I thought it was just such, Santa Barbara's always been one of my true loves. It's just such a special place. You like drive into Santa Barbara and you're kind of like, everything kind of comes down a notch, and just being right on the beach, you can't go wrong there, right? So I thought, location, our staff, and honestly, let's dive into a little bit of the content. It's really hard, obviously, to highlight one thing over the next, because we had such an unbelievable lineup of speakers who came out to join us. But why don't we start with kind of the split between the two worlds that we really try to emphasize. Dom, do you want to break down maybe something that stuck out to you specifically?
Yeah, sure. And I want to echo the sentiment too about the staff helping us. So, idyllic location. I want to, that you guys, congrats to you guys for picking this. I know you did a lot of work selecting, the ideal location to make this happen. And I can't imagine, a better one. So it's great in many ways. And and then, the passion and the expertise of our staff was really made it happen. And of course, the attendees kind of made it happen, and the speakers.
And the sponsors.
And the sponsors. Yeah, absolutely. The sponsors really were, they do play an amazingly important role on bridging the gap. Right. And that was, we kicked off with our keynote speaker, Dr. Jong Roe, who I really do credit him as getting me into this field, because his research drew me to ketones and, and neuroprotection, and then followed by Rhonda Patrick, who is kind of the leading voice when it comes to really, actionable things that you can do with the science, and that's what Metabolic Health Summit is really all about. It's about bringing in, not only do we have didactic, lectures and education, but we give you tools for implementation. And those tools could be breathing exercises that were done on the beautiful lawn in Santa Barbara, to the registered, the dietitians who were giving very detailed advice on how to implement dietary therapies, ketogenic therapies, and things like that. So you don't really get that in any other conference, where you have basic science, clinical medicine, and then the patient experiences probably resonated with me. Like when I go home, and I just go through the Rolodex of things that happened, during the event, it's the patient experiences that really jump into my head. And I think Miles Sullivan really resonated with me. I mean,
Yeah.
being diagnosed with a brain tumor and all the steps that he took, and the courage that he had to go down that path, and which took a lot of courage and a lot of persistence and fortitude. And I mean, he's like a walking example of kind of why we do what we do, and it's really resonating with patients. And but yeah, I mean, there's so many things I could talk about, but these are just the things that just popped into my head when I think about Metabolic Health Summit. Just the amazing staff, the amazing speakers, the attendees, the brands. I mean, it was just like amazing synergy. There's no way that you can replace an in-person event. I mean, you have in-person energy and then synergy between all the different components of that event. And that is super important. Although the virtual event, all I'm hearing is positive things coming out of that. So maybe we should discuss that too at some point, because that adds so much value to people who can't attend this.
Yeah.
And I know that was a big feat that you guys really in the background pulled off somehow. So
we had an amazing virtual team that was helping us around the clock for that. That was a totally new feature to Metabolic Health Summit. And honestly, we're so glad we did it, because it meant people from all over, people from all over the world come out. I mean, we'd had people from Egypt and Australia and everywhere in person in Santa Barbara, which always blows my mind. I just feel so much gratitude when I hear somebody's traveled so far to be able to join us for that weekend. But the virtual side really allowed to make it possible for maybe people who didn't quite feel comfortable yet to travel across the world or something to kind of be with us. The chat was nonstop going off, which was really, really cool to see. And people were very much involved, just as involved as people on site were, which was really cool. And so we do have the virtual platform up and available. We're going to get into that, because if you missed Metabolic Health Summit, you don't have to miss it, because it's still all available and you can watch all the presentations. So we'll kind of dive into some of the specifics about that. But Dom, to your point about Miles, I think, what a brave person to be able to continue, go through such a traumatic situation as he did, find such benefit in using ketogenic metabolic therapy, to stop his seizures, and now to share it with the world and really make it his mission to be able to bring other people into the mix. And he actually was connected to Josh Perry, who was actually at our conference, spoke and also performed on a BMX bike in the ballroom. And so those two connected through ketogenic metabolic therapy. Josh shared it with Miles. Miles is now sharing it with his community. And it's just really cool to see that spread like that. Another talk kind of on the same note is Dr. Chris Palmer, a Harvard psychiatrist, and his patient, Kristen Kehoe. I had chills watching that talk. It was an act of bravery that I just think is going to help so many people that might feel right now like there's no hope. Maybe they've been told, Kristen, she is somebody who's gone through just throughout the entirety of her life, mental illness. She's battled bipolar disorder. And then I believe at one point she was diagnosed with schizoaffective disorder, where she started to, go into sort of a catatonic state. She was hearing voices. It really got to a very, very dark place. And actually she had worked with Dr. Chris Palmer for over 17 years through all of these struggles and different medications that she'd tried that didn't really work for her. In some cases almost exacerbated her symptoms. She went through, drug abuse, domestic violence. I mean, it was just this story that you're like, this poor person has gone through this, now is up on stage with the courage to share, because she has now taken that. She implemented ketogenic metabolic therapy. It was kind of like the last resort. Dr. Palmer was saying, we've tried everything. It's ketogenic diet or bust. Like you've got to go this route. Like, let's give it a try. And it just started with little incremental changes, and literally got to the point where in a matter of months, she stopped hearing voices. She started to regain control of her life. She got out of the terrible, difficult relationship. It was like one piece of motivation and piece of willpower and feeling empowered, because she was able to do something, and maybe there was like kind of a shift in brain chemistry. She was able to make these little steps that led to her just completely changing her life. She's going through school. She's, got all kinds of goals and excitement for the future. And that was like, wow, this therapy is really going to change the world, especially when it comes to something like mental health. I think that, there are so many people out there suffering without answers. Maybe they've tried everything, much like Kristen has, and they feel like they don't have any hope. Whereas this, she was like, this is hope. This can work for you. Obviously, of course, so important to do this alongside your physician, much like she did with Dr. Chris Palmer. But I was blown away that this incredible human being in Kristen, she was able to kind of go through and survive, honestly, what she did, and then get on that stage and share it. And as Dr. Palmer said, not just for the people in the audience, not just for the people on the virtual platform, but for every single person suffering from a mental illness that feels like there is no other option for them. So that was probably one of the most impactful. And at the end, she got a standing ovation, of course, because it was just like, everybody was blown away, I think, in the audience at that point. And you can watch that presentation actually still on our virtual platform. And just the field in general of metabolic psychiatry, Dr. Palmer is really leading the charge when it comes to the research side, but also implementation with many of his patients. The fact that he was willing to get on that stage with his patient to have such an intimate discussion was really something I've never seen, honestly, at a conference before. So I just have to say thank you to Dr. Palmer and Kristen for sharing their story as well.
Yeah.
Yeah.
I was going to say, Dr. Shabani Sethi too, giving, following up on that, and her work at Stanford is also pioneering. So it's great to see, a lot of different PIs, investigators getting into this field, a very nascent field, but we know that it has significant effects, from the context of bipolar, where anti-epileptic drugs are actually the standard of care. So right. I think there's something to understand there in the context of the etiology of these things are largely unknown, but the dietary therapies can balance the neurotransmitters. And then, unlike, earlier today, I gave a whole lecture on dopamine and schizophrenia and typicals versus atypicals, mode of action, side effects. And I'm going through it and kind of biting my hand. I was like, should I talk about that? I was like, no, it's not part of, my outline curriculum for this particular course. But I kept thinking as I'm going through all the side effects of the typical, antipsychotics versus atypical and things like that, if dietary therapy should be taught.
And that's what, I think those stories and what you're talking about exemplifies why Metabolic Health Summit exists. When we started talking about putting something together like this, there was just such a need to get this information out there on a wider field and be able to present not just the patient stories. Obviously, those are so powerful. Miles, Kristen, that was just incredible to hear. And those are the things, like you said, Dom, that you go home from and you're still thinking about weeks, months later. And those, for me personally, is what inspires me to continue doing this work, right? It puts a face to what you're doing in a way that you can't replicate if you don't have that. And then, having those kind of conversations, they're so impactful, and it sounds almost too good to be true when we kind of exist in this world where, at least, a lot of times we think of, yes, diet might impact, prevention of disease, things like that. But as a medical therapy, strong. It's, what I mean? Knowing, and that's why we have at MHS, we have the basic science research, the clinical research, the clinical application, and then the patient perspective, because you can hear these stories and think, wow, that sounds amazing, but it sounds too good to be true. But then you listen to the next talk and you have a scientist saying, no, here's the pathway. I know why, we know why this works, right? It does. It is a neuropharmacological drug. It changes so much in a way that completely makes sense. And that's what, to get this kind of information, we want metabolic therapies, not just ketogenic diet, but kind of the whole of metabolic therapies to be at the forefront of the conversation. Patients and providers, patients, and their provider, off the bat. And the healthcare professionals are not getting a lot of this information in their training, and they want, you know, a place to get it, a trusted source of information. And that's kind of our whole goal, right? Is to like just provide this platform where you can, you know, that you can come and you're going to learn the most recent research, the like what we know and where things are going. And it's, you know, we spend a lot of time making sure that like the information we put out there is very evidence-based, and protecting the science is like so important to me. I'm probably like anal about it and maybe annoying to some degree, but it's just so important that we just make this, you know, available to not just clinical professionals though, but anyone who's interested in this information. And that's what MHS does, which is pretty special. And I mean, the talks, oh my gosh, all of them were fantastic. Allison Hull, I thought Dr. Allison Hull, who's a great friend, colleague, she's here in Tampa, works at Florida Medical Clinic. She has a practice where she treats babies to the elderly, and ketogenic metabolic therapy is like a large part of what she does in her practice. And she is so in tune with just the realities of how do you actually implement this in, you know, in a clinical practice, and all the little things you need to think about and how you go about it. And she did an outstanding presentation on that topic that I think any clinician who's using this or thinking about using it, oh my gosh, definitely needs to watch that presentation, because it was like a blueprint for success, which was pretty cool.
It really is.
Yeah, and she's so passionate and spunky and just really kind, and I just thought it was a great presentation. And gosh, yeah, there were so many good ones. And another fun one, I really enjoyed listening to Dr. Tommy Wood speak on Sunday, and he talked about basically the role of muscle. His talk was called More Bigger, More Brainier, which is funny. So he's talking about how, you know, maintaining muscle and building muscle, especially as we age, and how that directly like supports cognitive health as we age. You think about muscles versus brain, but it's not at all, right? They intersect, and they're really important. And maintaining your muscle, you know, as you age is incredibly important for maintaining cognitive function. And that was a pretty cool talk, because he did a lot of mechanism, and I always like to hear the weeds on that kind of stuff. But yeah, and I really like having the virtual component this year, because we're kind of running around like chickens with our heads cut off, right? Like during the event, we're literally like on stage, off stage. I know, right? And then funny. And then the event ends, and you're kind of like, wow, it's over, you know. And in the past, it's kind of like it really felt like over. And now I'm like, oh great, I can go back. I've like rewatched some talks, you know, or watched ones I didn't get to see live. And I just love that it's still up and available. You know, I can go back and
for anybody to watch.
Re-experience it. Because
totally, thank goodness we can, because we wouldn't have otherwise probably get to see the conference.
I know,
because we're on stage, we're off stage, we're running around. There's actually a lot that happens after the conference that people kind of don't see, of like follow up and all kinds of fun stuff. But yeah, the virtual platform really allows for anybody to jump in and watch these amazing speakers from, you know, clinical side to application to patient perspective, which is pretty cool. And, you know, there's some CMEs involved, which we'll touch on here shortly. But I think one of the beautiful things about the in-person event is some of the experiential stuff that you can kind of get to partake in. This year, we actually offered yoga classes and breathwork sessions, as Dom briefly mentioned. And that really, I feel like, brings things kind of full circle. The experiential classes, the wellness classes, all the way to the food that we sort of serve. And that's honestly largely possible to our amazing sponsors. So, you know, you could enjoy US Wellness Meats throughout the course of the weekend, which our Chef Yessie, we have to give her a little shout out from the Hilton, did a phenomenal job making incredible dinner at the gala out of that. And we had some appetizers at the reception, to Dry Farm Wines, sort of free flowing throughout the event. Special thank you to them. We had Good Idea in the mix, providing all the water, or this beautiful sparkling water, throughout the course of the event. Killer Creamery had a fun little Sunday bar at the VIP that was a huge hit. That was a lot of fun. You know, we've got just so many great partners that help us really make MHS happen, but not just by providing presentations and sort of helping us put on, bring out some of the best speakers, but also giving people down to the food that they're eating, how they start every single morning at the conference. Those details are accounted for, but it's only because, we've got some great partners that support us. So our Breath Collective and Samuel Whiting did our breathwork sessions in the afternoons, which was a total surreal experience because we actually had some thought leaders, world-renowned thought leaders, also taking those breath sessions along with us. So Dr. Jack Feldman, who provided a talk on breathing matters, sort of how we need to be sort of very mindful of the way we breathe, because it does make a difference in metabolic health, to James Nestor, who was in our book signing, who's a world-renowned science writer that just put out a book called Breath. So those moments were really pretty unique, and I think we weren't really sure what to expect to offer yoga, meditation, breathwork classes, because it is such a exciting and emerging area of research that is relevant to metabolic health, but maybe not everybody has given it a try yet. Maybe they've got sort of a perception of how it might be in their mind. And it was really cool to see all sort of walks of life and different kinds of people from different backgrounds doing this session together outside in beautiful Santa Barbara. It's a really just special moment. It's stuff like that I think really kind of sticks with me after the conference. And we actually have some of those breath sessions are still available on our virtual platform, thanks to Samuel putting stuff together and making it happen there. So you can enjoy those as well, even if you missed them, on the Santa Barbara beautiful lawn overlooking the ocean. And there's just something, I think, for me, this kind of on the same note about Metabolic Health Summit 2022, where it was like, unfortunately in 2020, we kind of, Metabolic Health Summit happened, and that was kind of the start of the pandemic, right? And now it just feels like,
we didn't start the pandemic.
No,
right?
we did not.
Just kidding. But again, it was very soon after.
Let's make that clear. Yeah.
Unrelated. No.
Right. We didn't start it. The conference just kind of bookended it, right? So we got the start of it, and then everything kind of shut down after Metabolic Health Summit 2020, not because of Metabolic Health Summit 2020. And then, you never know. And then, we had Metabolic Health Summit 2022. And for me, I don't know about you guys, but the last couple of years have been difficult for all of us, right? But I've been especially careful, and kind of just because I was so sick, unfortunately, from long COVID, to, not sort of do large social gatherings. So this was kind of like the first, this was a really big pivotal moment for, I think, a lot of people, where it was like, okay, this is the start of a new chapter. We're coming together. Yeah. We're so excited. I mean, the gala was probably the best gala we've had. That was
ever. Amazing. They had to kick us out. They were like, okay, literally turning on the lights. Like, could you get off the dance floor? We got to clean up.
Yeah, it felt like the start of a new beginning. And it felt very much like people were more excited than ever and saw the value more than ever of why we need to get together as human beings and collaborate and inspire each other and hug each other and smile and, all of those things. So that was, for me, it was just the energy. The energy is always amazing at MHS, but this year was special. A pivotal moment, Yeah. So the other piece of it was our expo. Our expo is always a unique, I wish I could spend even more time than I'm able to. It feels like it goes so fast that I don't get to spend nearly enough time with everybody, to be honest with you. But the sponsors that support our event are so important to us and so special to us. And that was just such a cool thing. I mean, from, you're getting keto pancakes all the way to you're able to breath test and blood test and take exogenous ketones. I mean, it's like a true A to Z experience of what is available on the market that is making the science feasible in real life for people. Maybe some people who, would otherwise look at the diet as being so challenging. These are the companies that are bridging the gap and helping us make it happen in the real world. That's sort of my 2 cents. Dom, what are your thoughts on that whole sort of side of things?
Yeah, the companies are providing tools that make what we're doing possible, from ketogenic diets to just low carb. Look, you got Legendary Foods making like a ketogenic tasty pastry, i.e. Pop-Tart. And then you have breath ketone, like the Biosense device, Keto Mojo. You have brain health, first person bringing out products, mushroom products to enhance, our brain health.
Yeah. Keto
So
brains too. Speaking of brain health,
absolutely, yeah. That's my next. Yep. So, I'm actually drinking that now. Keto brains in my coffee.
So good.
That fueled my last couple lectures I was teaching today. So, I think I can't say enough thanks, for our sponsors. They're really helping us implement these approaches, and I think they're really helping to advance, the science of what we're doing into applications. And I think that's a big part of what MHS is about.
Yeah.
Yeah. And if you think back, 10 years ago, earlier in kind of this path of the research, I know, Dom, we used to get told all the time, you still hear it, but it's not sustainable. No one can do it. It's so hard. No one will do it. And now it's no, it's actually pretty easy. You can get a replacement for whatever, there's something that you don't want to give up. I'm sure you can probably go find something. And just even thinking about a few years ago, earlier in the, the first MHS, what brands were in this space, and it was just a little seed, it felt like at that time, and who was making products. It was very, very, very novel. And now the choices are just, there's so many amazing brands in this space that are really doing it right and paying attention to the quality of the ingredients, just from A to Z, really, really caring about the product they put out, and giving, people who care just as much about what they consume, a product for them. And that's been really special to see, because I think it does make a huge difference.
Oh yeah. And the technologies too that are out there now, that's really an exciting part, I think, and an important part of metabolic health. Part of the reason why we had a whole biotechnology panel at the conference, because it's so important to have a conversation around this kind of tech. So Keto Mojo was a part of that, Biosense, Biocanic. There's a lot of really amazing technologies that are making this not just possible, but just patient adherence and continuous monitoring, and just making it fun for people as well. I think people are really getting into understanding their bodies through breath testing, through blood testing, through having a platform where that you can synthesize all of your data into one. People are really starting to become empowered, and it's thanks to technologies like this.
Yeah, I think people used to just have to kind of shrug your shoulders and think, well, I hope what I'm doing is going to be good for me in the long run, I don't even know, and now you can, with these technologies, you can really see your own personal data. You can have really easy conversations with your provider. They can see much more than they were able to monitor, 10 years ago. For the research side of things, these kind of technologies make it way, easier for studies to be done in a good way, where we can follow compliance and in just a way that was not possible, especially for perhaps a diet trial. 10 years ago, you're kind of well, I hope they didn't, drive themselves to fast food or something. But now you're no, I saw it. No, just right. But no, really, it's very true. A huge difference. It's huge. Yeah. Making a huge difference.
I have some comments about that. I know, from our clinical trial that still we're collecting second cohort data. When you track something and you observe something, when the patient is doing that, it changes the outcome. So observation, tracking, monitoring changes the outcome of that patient when they are aware and when they know that they're being observed, that actually changes the outcome in a profound way. So that's a big message, I think, and I think that's going to really help with developing the apps, making them more engageable by the patients, because where their healthcare provider can also look at the CGM response or the ketones, the blood ketones, the breath ketones. So we know when we observe something, we change the outcome. even on a subatomic level, if we're talking about like spooky action at a distance, with quantum mechanics, which is like, an area we know that when we observe something, we change the outcome. Right. And this is like super important. And I think there's so much room to work with the tech industry to create tools that can allow the patient to observe their metabolic profile, their ketones, their blood markers, and then have that data uploaded to a platform where the people that are taking care of them, their doctors, can also observe that data. It's really going to be a game changer, I think, for health.
Yeah, and it puts the patients back in the driver's seat. I think for way too long, patients have felt like a passenger or a bystander in their healthcare, and you just, hope that you're on the right path, but you don't really know, and it's not really up to you. And I think people are done with that. They want to know, they want to be an active participant in their journey, whatever journey that is, whether, it's just thinking about age-related chronic illness as we age and trying to maintain a healthy lifestyle and maximize, health span and lifespan, or if you're on a journey for a particular medical condition, cancer, seizures, diabetes, any of these things. And just giving a patient an ability to play an active role in their own care is hugely impactful and really, really changes their outcome. So I think it's an exciting time, honestly, for the field. And some of these brands that are providing tools to make that possible are really just making a big difference.
Yeah, I agree 100%. And, it was exciting to see the diversity in the brands, I think, this year that supported MHS and those that are excited about elevating the research just as much as we are. I think that, there are some brands that are more committed to that than others. Of course, we had HVMN, we had Ketone IQ, who they actually did an entire special interest forum on some of the research they're involved in with special operators. There's just, it's really an exciting time to kind of see this, or even with Ketone Technologies, what you guys are doing and supporting the research and whatnot. And then through the education piece of keto nutrition, there's a lot of people that understand the importance of supporting the science and doing so through something like Metabolic Health Summit. It's been exciting to see companies wanting to give back to the research and support it in that way. We've also got Diet Doctor, who did a complete full weekend live coverage on social media, nonstop action. Dr. Brett Scher and Dr. Ted Naiman were nonstop throughout the weekend. You can actually catch all of that content. These are just interviews with speakers, thought leaders, some of our sponsors that you can find on Diet Doctor's YouTube channel or right here on Facebook, as well as our Instagram. You can go back and look through all of those incredible conversations, just sort of behind the scenes action. So special thank you to Diet Doctor, of course, and then all of our participants, of course, that donated on the food front. We've got Icon Foods, who have these new crazy little Shelbies that are kind of like M&Ms, but keto. They're kind of ridiculous, that were a part of the Killer Creamery Sunday. We had Bioptimizers, who were in the house and the huge supporters this year. Good Idea, of course, as I mentioned, Killer Creamery, Dry Farm Wines, who've supported us since day one and always start the party at MHS. And of course, Biosense Keto Mojo, as we mentioned, and Audacious Nutrition, which is a great new exogenous ketone company that you'll definitely want to check out as well. And then all of our silver and bronze partners too. I mean, this conference would not be possible without support from our partners. So special thank you to those who do support us. And let's talk briefly before we go about this virtual platform. So all of the content was recorded. So every single presentation, every single panel discussion, breathwork sessions, special events, you get to see the hand balancers that came out and performed from Las Vegas, which was unreal. If you've not seen that, definitely check it out. In support of the Charlie Foundation and Max Love Project, you can catch the entirety of MHS 2022 like you were right there in all the action on our virtual platform. And to access that, head on over to our website, metabolichealthsummit.com, purchase a virtual ticket. We have a virtual ticket it's under $100. It's $99. Then you also have a virtual plus CME ticket, which Angela, do you want to mention how long you can earn CMEs by watching all of that great content?
Yeah, so we were excited to learn that we could extend that window. So originally we were only going to be able to allow people to claim CMEs for 30 days following the event, but we've been able to extend it to 60 days, which is fantastic. So that's 60 days following the end of the event. So the last day to claim CME credit would be July 8th. And so there's a lot of time to get in and be able to watch that content and then claim your credit if you're interested. And the content itself will be available through the end of October. So people can still, continue to get access to that content and watch it and rewatch it and take notes and whatever you want to do. If you do want CMEs, though, do that soon and just make sure that you go through all the content and then claim your CMEs by July 8th. But you can go back and rewatch if you want to after that. It'll be available, through the end of October, I'm so excited about that component this year because it really does just go by so quickly, and you want to be able to like easily review it. Or maybe, it's so hard. We always have like multiple things happening at once. You might have been in a breakout session, but you really wanted to catch what was happening on the main stage too. And this is a really great way to be able to go back and do that. And if you were an attendee at MHS in person, you have access to the virtual platform. So you can just, sign in. You should have gotten some information. If you can't find that information, you can reach out to us, contact@metabolichealthsummit.com, and we'll make sure we get you into the platform. But it's a really cool platform. And we have the presentation, PDFs of the speaker slides are attached. If you go into a symposium, like you can just download those. Those are especially helpful, especially if you're getting CME credit and you want something to reference later on. So it was a really cool ad this year. I remember when we were starting that process, we're like, oh my gosh, I think we're like planning a whole second event. It was like lot of work to make it happen. But after the fact, it was just clear that it was just a really important piece of the puzzle to bring together more people and to make it more impactful for anyone who is there. Because a lot of people at MHS like to spend time networking. It's really, that's an incredible part of MHS is you get to be with people that, are super passionate. And, I think one of my favorite things about MHS is just the energy. Literally no one is there for any other reason other than them being extremely passionate about this topic. Like, it's not a conference that like, oh, it's on my calendar every year. I just show up because, I need to do whatever. I have to check it off the list. Like, every person who's there is like super passionate about this field. And it makes it pretty special in that regard.
Everybody's on ketones, I like to say, whether it's exogenously or endogenously, they're high on keto. No, everybody's so kind and just excited about the field just as much as we are. I've popped the link down below, metabolichealthsummit.com, for anybody who wants a virtual ticket. You have access to view it all through October. And it's a really unique platform. And you can also see all of the brands that participated, all of their information. You can also download PDFs of some of the poster or the abstracts from our poster session. You can also download all of the slides from each of the talks. It's not just like watching the presentations. This is a really dynamic platform and a lot of benefit for a very minimal cost when you consider all things. I can't thank everybody who attended MHS enough. We would not have been able to do it without our attendees, our speakers, our sponsors, our staff, our volunteers. The three of us, I'm just so thankful we did it and it happened and it was amazing. And thank you two for just an incredible weekend. It's it was unbelievable.
Well, thank you guys. I know, you guys did a lot to make this happen, especially the virtual platform, which is an amazing opportunity for the people who purchased that. They can watch it from, the comfort of the bathroom to the beach.
The bathroom to the beach.
Let's be real.
And they can stop and go. Yeah. And, when you listen to something over and over, then you pick up on things too. So, and these are the types of lectures that you might want to go over and stop, take notes and stop and go. So that's a huge, huge thing to have that in place. And man, we live in an awesome time where we can have this. Maybe COVID helped facilitate a better virtual experience because everybody is jumping to the virtual platform. So I'm just amazed at how smooth it went and how I'm getting a lot of great feedback. I'm asking for negative feedback on the virtual platform, but I've not gotten any yet. Like I had told you, it's like everything is just really just positive feedback about the virtual platform. So
that's awesome.
Yes, if you're listening to this and you didn't get an opportunity to be there or to watch the talks yet, the virtual platform is there for this. It's an amazing opportunity, and I encourage you to take advantage of it.
Yeah, absolutely. And I think we will be in touch very soon. We'll be popping back on live. I know we're getting a lot of questions around when's the next MHS. Trust us, we're working very hard to be able to announce that hopefully this summer. So stay tuned. Make sure you subscribe to our newsletter. Follow us on social media. We'll be putting that information out there. You won't want to miss the next one. In person is virtual is amazing, but in person is really where a lot of the magic happens. So thank you guys for helping. I'm just so grateful for the entirety of the experience, to be honest with you. And I feel like this is a new beginning, and the future of our field is so incredibly brighter than ever, to be honest with you, especially after everything we've been through. I think like the future of metabolic based therapies is now. So we'll be in touch soon, and thank you guys for hopping on this morning.
Yeah, my pleasure. Thank you.
All right. We'll see you guys. Thanks so much for watching. If you have any concerns, questions, you want to give us feedback about MHS 2022, email us at contact@metabolichealthsummit.com. We'd love to hear from you. We're always trying to grow. So in the meantime, we'll see you guys soon. Bye.
Bye.
Bye.